One bite from a sandfly, one parasite, and 3 ways it can change your life to skin ulcers, organ failure, or facial disfigurement. This is leishmaniasis. Leishmaniasis is a parasitic disease transmitted by sandflies with 3 main forms, that is, visceral, cutaneous, and mucocutaneous. It can range from mild skin ulcers to life-threatening organ damage. Let's begin with its etiology. Leishmaniasis is caused by Leishmania parasites transmitted through the bite of infected female sandflies. There are over 20 species which can infect humans, each with its own clinical twist. In a recent study, its prevalence is estimated as 700,000 to 1 million new cases annually, and the most affected regions include tropical and subtropical regions, especially in Africa, Asia, America, and the Mediterranean. One of the risk factors to infections include poverty, malnutrition, displacement, poor housing, and weak immune system that increase vulnerability. Briefly, let's discuss about the types of leishmaniasis. Leishmaniasis presents in 3 main clinical forms, that is, cutaneous, mucocutaneous, and visceral, each with the distinct symptoms ranging from skin ulcers to life-threatening organ damage. The severity and progression depends on the species involved and host immune response. Let's break it down, starting with the cutaneous leishmaniasis. It's the most common form and causes skin ulcers that can lead to disfigurement and social stigma, while visceral leishmaniasis, which is also known as Kala-Azar, is the most severe form, potentially fatal if untreated. It affects the spleen, liver, and the kidney, whose symptoms include prolonged fever, hepatosplenomegaly, pancytopenia, and hyperpigmentation on the skin. On the other hand, mucocutaneous leishmaniasis is less common but more destructive. The parasite migrates from the skin to mucosal tissues of the nose, mouth, and throat, causing nasal congestion, ulceration, and difficulties in speaking or swallowing food. Next up is pathophysiology. Leishmaniasis begins with a bite whereby a tiny sandfly, barely visible, delivers a parasite with a powerful punch. Leishmania. Once inside the body, the parasite invades macrophages, which are our immune defenders, and transforms into a mastigot. Depending on the species and your immune system, leishmaniasis takes one of the 3 forms, either cutaneous, mucocutaneous, or visceral, whereby cutaneous will cause skin ulcers, while visceral attacks deep organs, and the mucocutaneous erodes the nose, mouth, and throat. The mastigots multiply within the macrophages, eventually causing cell rupture and spreading to other cells. Did you know that fever, weight loss, enlarged spleen or liver are related to visceral leishmaniasis? While mucocutaneous destroys mucous membranes, leading to severe facial disfigurement. Diagnosis relies on microscopy, molecular tests, and serology, while treatment depends on the form and regions, whose options include anti-immunogens, amphotericin B, and paromomycin. By the way, prevention is all about vector control, using insecticide-treated nets, repellents, and reducing sandfly habitats. Leishmaniasis may be ancient, but awareness is the modern medicine first defense. So, share this video, protect your community, and stay curious. Thanks for watching. My name is Skylar.